صباح الخير. Good morning everyone. My name is Dina Munji and I am part of the board of directors of the UAE Food Cluster. Just as a summary, the UAE Food Cluster was established by His Excellency Abdullah bin Tuq a year ago, and part of our mandate is to be the conductor between the industry and the government. And this is why, as per popular demand today, after hearing from the industry, it was important for us to host one of the most strategic alliances that we have, which is with the Ministry of Health and Prevention, in order for you to have a first-hand experience and sneak peek at the National Strategy for Healthy Nutrition 2031. It's a very bold strategy, and I think this session will help you understand a little bit from the Ministry of Health what are the principles of these strategies and what type of collaborations we can do as an industry with the ministry to move the strategy forward. I am very pleased today to have a very excellent speaker from the Ministry of Health and Prevention, Dr. Anouf Al-Khamis. She's here to give you a sneak peek about the strategy, to hear from you and to conduct a two-way conversations so we can materialize the strategy going forward. Dr. Anouf, the floor is yours.
Assalamu alaikum, good morning everyone. So thank you first of all, Dina, Mr. Wahid, for bringing everyone here today. And as Dina said, I think the National Nutrition Strategy, this is one of the strategies that have been launched by the UAE Cabinet this year. And within this strategy, we have a lot of common projects and initiatives that definitely we do see a role for the industry in accelerating and achieving the goals of this strategy. So today, briefly, I'll be taking you through this strategy just to give you an insight of what it is and what do we include within this strategy, because as we said at the beginning, we are working together, so we want to make sure that you have this understanding and you are aware of what is going to come in terms of activities and initiatives to make sure that you are all prepared to be part of achieving the goals and initiatives of this strategy. So to start with, as you all know, the Cabinet has been recently approved by the UAE Cabinet, chaired by His Highness Sheikh Mohammed bin Rashid Al Maktoum. And within this strategy, or for the development of this strategy, we have ensured that we work in collaboration with different entities to make sure that we encounter and take into account all the perspectives from different institutions and different organizations. So we had different workshops where we worked with different stakeholders from the health, from the education, and also we had presentation from the FMB as part of this to make sure that, as we said, we capture all the perspectives to make sure that we really develop a strategy that will support the health of the UAE. So the strategy, as you can see, it's really a comprehensive framework. The goal of it is really to enhance and improve the UAE health through promoting healthier and more resilient systems. This strategy aligns really well with the UAE Vision 2031 and supports the nation's aspiration for enhanced quality of life, improved public health outcomes, and the development of a healthier, more resilient, and future-ready society. Our objective with this strategy is to promote healthy diet from sustainable food system, which really aligns with a lot of the strategies and vision here in the United Arab Emirates, like the National Strategy for Food Security. Also, we want to prevent the malnutrition across all age groups, reduce the nutrition-related non-communicable diseases, and strengthen the nutrition governance and legislation through having a more sustainable framework to follow the work, and improve quality of food and safety of the food, and enhance data systems and research capacity, which definitely will help us to better improve and develop our programs and initiatives. But before we dig more into the strategy, let's look first at some of the facts, some of the data that we do have. So when it comes, as you can So as you know, we have recently announced the results of the National Nutrition Survey, which was the first survey conducted here in the United Arab Emirates. Within this survey, we have collected data related to the health status here in the United Arab Emirates and nutrition-related information. So based on the main findings, we found that 22% of our population are suffering from obesity. And as you all know, obesity is a result of different factors. One of them is definitely nutrition. When it comes to high blood pressure, 26% of our population are suffering from high blood pressure. 54% of our adults have high blood cholesterol, and 12% of our adults also have high blood sugar. When it comes to children, the prevalence of obesity among children is already 68%. So when it comes to the lifestyle risk factors, and as you can see from this slide, 56% of our population exceed the recommended levels of fat, 27% exceed the recommended level of sugar, and 27% of our population are consuming more than one serving of sweetened beverage on daily basis. When it comes to fiber, 23 gram per day is the average fiber intake of our population. And not surprisingly, when it comes to sodium, 96% of our population are exceeding the recommended level of sodium intake. So we are talking about an average of 5,000 milligram per day compared to 2,000 milligram recommended by the WHO. When it comes to the overall total calorie intake, we are talking about almost 2,800 calories per day, which again exceed the levels recommended by the WHO to maintain a good health and avoid the complications related to that. As for physical inactivity, so we are 60% almost of our population are not meeting the recommended level of physical activity, which is 150 minutes per week. So as you can see, we are not really doing well when it comes to our health. We do have a lot of problems, a lot of issues that need to be tackled in collaboration with everyone. So when it comes to, this is again a summary of for the micronutrients. So as you can see, whatever is red it means excessively high. The orange is below the recommendation. Yellow is significantly low, and the green generally adequate, and the bright green is adequate. So as you can see, we do have definitely issues with sodium, as I said previously. Vitamin D, definitely, it's an area we can also work on. The calcium, as you can see, the folate, and vitamin A. This is for adults. And when it comes to children, again, there's a high intake of sodium for children, low or insufficiency when it comes to vitamin D, calcium also considered to be insufficient, folate, zinc also, and vitamin C. A study done by an economic feasibility study that have been done in the United Arab Emirates shows that 55% of all deaths in the UAE accounts to NCDs, and 34% of these are attributed to cardiovascular diseases. When it comes into cost, we are talking about more than 40 billion dirham spent on treating and managing those health issues. But the good news is that we can really work or move from challenges to more of health and economic gains. So another study have showed that if we invest in initiatives and programs and strategies that focus on reducing the salt consumption, improving the dietary patterns in general, and increasing physical activity, we could really save or have return on investment, which is almost to 1.45 billion dirham within 15 years. So with that into consideration, we have developed our strategy framework to make sure that we incorporate within the strategy the initiatives and the programs that will really support the health here in the United Arab Emirates, and it also reflects really the needs of our population, the challenges that we are facing here, to make sure that it is really tailored to our country and to our environment. So our framework for this strategy, our vision is to build a sustainable, healthy food system that enhances quality of life. And within this strategy, we have three main strategic directions. The first strategic direction is achieving a shift in the food sector toward healthier alternatives. And I think this is where a lot of the work that the industry can really support to push the agenda of the health here in the United Arab Emirates. So within this specific strategic direction, we have different activities, different initiatives. So things like the banning the hydrogenated oils. We have also the food reformulation, and I'm sure a lot of you know about the food reformulation project. And we have also the implementation of the second phase of the taxation which already took place early this year. And also we have the FMB pledge, which I think this session will be a good introduction to achieve the goals of that initiative. And then the regulation of marketing of unhealthy food and beverages targeted to kids. The second strategic direction is more about raising awareness and improving the knowledge and the attitudes and behaviors among the population. So we have the health promoting retails initiative within this strategic direction. Then the information on the food menus. Again, this is another way to promote and encourage people to better understand what they are eating and what they are consuming. We have also the updates that will happen on the nutrition guidelines, especially that we do have now the data that is related to our population. So definitely we will be moving forward to make sure that our guideline is really reflecting our needs and our health status. And then the Healthy Restaurant Initiative. The third strategic direction is really focusing on healthcare and how can we strengthen the preventive health care through nutrition. So we have things like promoting the health of children under 5 years of age. So this will be really focusing more on the early discovery of health issues related to nutrition and the early intervention. And then we have also the supplementation program that also will be built based on the results of the National Nutrition Survey. And the third one is the food fortification with vitamins and minerals that also will support definitely solving a lot of the issues, things like the micronutrient deficiencies that we had. So for us to be able to govern this strategy and make sure that we really evaluate and enhance the work of this, we have two also strategic enablers. The first one is strengthen institutional readiness and capacity building to promote healthy nutrition, and we have two main initiatives within that, which is enhancing the quality of foods and beverages provided in educational institutions and also in public institutions, and also develop regulatory infrastructure and enhance data integration to make sure that we do have that full management of everything related to nutrition. So within that we have the National Nutrition Surveillance System project, which will give us a better understanding of our health status, and this is something that have been, let's say, done by the initiation of the nutrition surveillance, and also to monitor the progress of these indicators to make sure that we have inputs and data that will support us in evaluating the programs and the initiatives that we do have. And database of nutritional composition of local food, which is really important to make sure that we have all the information needed. So this is a summary, brief about our strategy, and I'm sure that we will have more chance to hear your questions and discuss it more in the upcoming session. Yeah. Thank you, everyone.
Thank you so much, Noor, for the presentation, and good morning, everyone. My name is Fatma Al-Matroushi. I'm the head of Health Education section at the Ministry of Health and Prevention. Thank you all for accepting our invitation for this quick brief about our strategy. I'm not going to take much of your time. I just want to highlight a couple of our engagement principles that we want to assure you with them in order for you to how to carry actually this strategy forward. I think a lot of initiatives started to have some sort of buzz across the couple of months, the previous couple of months. For example, the food reformulation project. And then we want to assure you that we will have a formal consultation, depending, of course, on the nature of the project that we are handling. We are committed for that. We want to actually hear directly from the industry. We want to hear your opinion about our upcoming project. This is very important for us. I can guarantee you there will be a seat at the table to hear from your own perspective in terms of those initiatives. This is not the first engagement, and this will not be the last, of course. We're planning for many engagement or touch-up points moving forwards, depending, of course, of the nature of the project. Again, to hear from you, to enhance this openness when it comes to the dialogue, and then to hear your opinion about our projects that are happening. We want to welcome all the joint collaboration. Some of those initiatives will be proactive from our end, but some of them actually we would like to hear your input on them. We will have definitely thinking about the capacity development within the industry in order for small enterprises, for example, to take on those initiatives as well. We're not forgetting about them. And then the most important part, I think, for us, we want to honor those who will be the first to take those steps. We want to recognize them. We want to honor them in front of everyone. So we put the strategy in front of you. We would like to hear your input. We have a dedicated session, Q&A, that will be led by Dr. Anouf and then Dina. And then thank you so much again for everyone for coming, and best of luck. Thank you so much.